Welcome to Retrain Your Thinking with Pastor Johnny. Today, we want you to enlighten your mindset and change your world. I'm talking today about mental health issues in neglected communities. And I have a very special person with me. Sandra Jones is our guest today. She is a licensed professional counselor. She works with all of these types of mental health issues we've been hearing about. Welcome, Sandra.
Thank you for inviting me, Johnny.
Yes, so happy to have you with us today. We're going to jump right in, and I want you to tell me a little bit about what an LPC, I think is what you are.
It's LCSW.
LCSW. Tell us a little bit about what that is. You can see I don't know.
LCSW is a licensed clinical social worker.
All right. Okay.
And I've been a social worker now for about 42 years.
My goodness, Sandra.
Yes.
Yes. Well, that's great. So, how do you become a licensed professional social worker, clinical social worker?
Yes. My undergraduate degree was at Dillard University. And initially, in going to Dillard, I didn't plan to be a social worker. I didn't plan to be a counselor. I was going to be a nurse.
Oh,
But
okay.
the second year into that field of study, when we started doing vital signs and all of that stuff, I said, nah, this is not for me. So when I finished Dillard, I started to work for a mental hospital in New Orleans.
Wow.
And the name of the hospital was DePaul Community Mental Hospital.
Mm-hmm.
And that was my first taste of mental health. Uh, it was very enlightening.
Yes, I
And
can
I can tell you a
imagine.
lot of stories about that
Yes.
experience.
Mm-hmm.
But because of that experience, I was inspired to go on and get my master's from Tulane University in New Orleans
Mm-hmm.
in the field of social work.
All right.
So that's how my mental health career began.
Yes.
After getting my master's at Tulane, I returned back to Fort Worth and I started to work at John Peter Smith Hospital, working with chronically ill patients in counseling, and some of them, terminal.
Yes. Yes.
Uh, I moved from there and worked at Child Study Center in Fort Worth for about 10 years, working with high risk parents who were on drugs during their pregnancy and then followed them throughout their pregnancy. And then we worked with the infants.
All right. So
Uh,
you worked with the whole family.
we worked with the
The
entire family.
okay.
It was an early childhood program for
Mm-hmm.
developmentally delayed
Individuals.
infants
Yes.
and their parents.
Yes.
Uh,
Yeah. Well,
I,
what exactly, when you say you're a clinical social worker, is that different from a regular social
yes,
worker?
it is. You work in a clinic setting and you provide counseling.
Mm-hmm.
I was particularly, of course, drawn to the mental health field.
Yes.
So all of my practice, I've worked clinically with mental health patients or people presenting with mental health issues.
Yes.
Uh, some of those issues being depression, anxiety, bipolar, schizophrenia, you name it,
Yes.
uh, grief.
Yes. What do you think drew you to mental health as opposed what there could have been any a number of areas in clinical social work, I suppose, that you could have.
Well, as I said, working at DePaul, I became intrigued with why. Uh, DePaul was a revolving door for chronically mentally ill people,
Mm,
some of which had uh, been patients on and off most of their lives.
my goodness.
Um, as a psychiatric assistant there, they assigned me to go up with the patient to get ECT treatment, which I thought and still I still feel that is barbaric. They use that as an alternative to using medication when all medications have been tried and there seems to be no progress.
And for someone like me,
Mm-hmm.
not really knowing many medical terms like that, so what's that? ECT.
ECT is electroshock therapy,
Oh, I
and
see.
it's utilized by attaching electrodes to the brain, and certain volts of electricity
Mm,
are given, and it's with the intent of wiping out uh, what it does. It wipes out memory,
yeah.
so that whatever is depressing this person, uh, it goes away.
Oh my goodness. It reminds me so much of one of the very first movies that I saw right after I married over 50 years ago. Um, was One Flew Over the Cuckoo's Nest. And it
Yes,
sounds so this guy had so much energy, and he was always trying to help the others retrain their thinking.
yes,
Don't let them tell you how to think. You
right,
and finally they took him and did something to his brain, and after a while, he was just like the others, just docile.
right.
And I thought, my goodness, I think I cried, cried, cried from that movie. So there
Mm-hmm.
is a procedure where that actually happens.
Yes, it is, and that's
Mhm.
the intent, to retrain their thinking.
Oh my
But in
goodness.
doing that, it destroys your thinking,
Yes.
and that's why I'm so opposed to it even to this day.
Oh my goodness.
Um,
Yeah.
I am not as opposed to medications. If you find yourself in a dark place,
Hmm.
maybe medications can help you get back to where you need to be.
To need to be.
But sometimes we wait so long until it's
Yes.
hard to pull
And
ourselves
that
up out
sort
of
of
that.
therapy is still used today?
Oh, ECT?
Yes.
Absolutely, it is.
Well, I do say.
Yes.
Well,
There are some doctors who do it.
well. Well, that is so interesting. And we really want to know a little bit more about exactly what are mental health issues. We've seen a lot of people talking about them in recent days.
Yes.
Taraji P. Henson has made a big deal of
Yes.
mental health issues, especially in neglected communities.
Yes.
So we want you to just tell us a little about that and what we can do to recognize it, what we can do to know whether or not it's a mental health issue or a personality issue.
Oh, wow.
Yes, and as we're getting ready for a break right now, but when
Mm-hmm.
we come back,
Mm-hmm.
then we want you to talk about that and just tell us if I have a son who's lazy. Is it mental health issues? We'll be right back and we'll continue talking with Miss Sandra Jones. All right, all right. Welcome back to Retrain Your Thinking with Pastor Johnny. I am talking to Miss Sandra Jones, who is a licensed clinical social worker.
Yes.
And she has so much to tell us, especially now during this time of COVID,
Mm-hmm.
where we are learning more and more about mental issues.
Yes.
Now, Sandra, we've seen in the news a lot of times
Mm-hmm.
where persons, and it just seems to be a lot of black males,
Mm-hmm.
have been shot and killed by police
Mm-hmm.
who who really understandably didn't know the situation or if their own lives were in danger.
Mm-hmm.
But we've seen these persons, as it turns out, had mental health issues. Do you think that's a bigger problem in, we call them neglected communities, because we know those communities don't have all the resources. There are no hospitals available readily, not even grocery stores where you can get food
Mm-hmm.
available readily.
Mm-hmm.
So, do you think that there are more problems in neglected communities with mental health issues from your experience?
Absolutely. Um, when we talk about accessing mental health resources in the Black community, it's non-existent unless there's a state agency providing services. Most counties have state agencies, like what they call in Fort Worth MHMR, or in Dallas County Metro Care. Uh, but that's the extent, pretty much. You may find an agency on a sliding fee scale that will accept patients with mental health issues. A lot of mental health issues in the Black community go unidentified
Oh.
until there is a crisis. Uh, a lot of our people are in denial about whether or not they have a problem.
Yes.
And I remember back in the day, the one of the main things that people are being told by the grandparents about a mother, just pray about it, baby.
Yeah.
I believe in prayer. God can do anything.
Yes.
And God is in the center of all of this. Even in my practice, He is the healer.
Yes.
But at the same time, you have to acknowledge the fact that something is wrong here with me,
Yes.
and
And
reach out beyond yourself.
yes.
But when but in the Black community, uh, especially our Black males, they're coming around more and more. And even Hispanic males are coming around and accessing mental health services more than ever before. But when you get ready to reach out for help, where do we go?
Yeah. Yeah.
And that's the issue.
That becomes the issue.
That becomes the
Yeah.
issue.
So you mentioned the denial about identifying the problem
Mm-hmm.
and accepting. What are some of the ways that some of the things we should look for? I guess I should say for mental health problems within a community.
Oftentimes,
Mhm.
when a person is dealing with a mental health issue, it can manifest itself in many different ways. Some people isolate and withdraw. And if you see someone withdrawn and not wanting to socialize, don't want to come around, or staying in their room all the time, staying in the dark, letting the blinds stay closed all day long, afraid to go to the grocery store, afraid to come out of the house, afraid to drive. Um, those are some
Those,
of the
yes.
concerns. And then you get into the more severe mental issues where they're hearing voices, or you see someone talking to themselves out loud, and
Then you know there's a problem.
right, there's a
Yes.
problem there.
Yes. What should family members do when they start? So many families like to push it under the rug. They don't want anybody else to know. Does that make the person worse, or what should family members
If
do?
nothing happens, nothing is going to change.
Mm-hmm.
But
Very good.
the individual, the way our system is designed in our society, is that if a person doesn't present themselves voluntarily,
Yes.
and if their behavior poses a threat to you or to themselves, then we can act on it and get them some help. But it's involuntary at that point.
I see.
Okay,
Well,
but they have to be willing. If Pastor Johnny, you feel like you have a problem, you say, saying I'm sinking deep, I think I'm having a nervous breakdown, then I'm gonna say, okay, Pastor Johnny, why don't we go to Green Oaks and let them do an assessment on you?
mm-hmm.
And because if you feel that you're suicidal, and you can't promise me that you're not going to be okay if I
Then
leave
we
you,
need to.
then that's what we need to do.
I see.
So if Pastor Johnny goes voluntarily, that's good.
Mm-hmm.
But if Pastor Johnny says, "Oh, I'm okay. I don't, I'll be all right. I don't need any help.
Mm-hmm.
I'll get through this. I felt like this before." Um, then it goes untreated. until there's a crisis.
Yes. Well, I'm thinking of a family member with a son who has who's old enough, I guess, to say that he can make decisions for himself,
Hmm.
but he clearly has mental health issues.
Yes.
If that person or a person
Hmm.
decides that they don't want to accept the help, they don't
Hmm.
want to go into therapy or that, how can you make them? What is the family to do?
Again, that's where you have to at least contact the police and tell them that we have a family member here and we feel like he's going to hurt himself, or we're afraid for him to be here because he's acting out violently. He
Mm-hmm.
needs to be admitted, but he won't go.
Yeah.
Instead of taking him to jail, what they will do is take him to the nearest psychiatric hospital.
Mm-hmm.
However, in doing that, they can only keep that person for 72 hours
Okay. And then they can
involuntarily.
involuntarily, and they can make the decision themselves to say, I don't
Right.
want to stay here. I no longer want to be here.
Exactly.
Yes.
However, if after 72 hours that person is still acting out and suicidal, the hospital can opt to keep it.
Oh, well, that's interesting
Yeah,
to know.
because they don't want to be liable for him
Mm.
going out and
And killing
hurting some.
himself or somebody else, hurting
Yes.
himself
Yes.
or someone else. That's very
Right.
interesting to know because many families just feel, I don't know what to do. If they won't stay, I can't make them, and the agency is telling me that they have the right to leave because of their age.
Exactly.
Very, very interesting. Well, we're going to be right back and we're going to continue this conversation about mental health issues, especially in neglected communities, and exactly what we can do, and mental health issues during the time of COVID. Is
Okay.
it different or the same?
Okay.
Welcome back to Retrain Your Thinking with Pastor Johnny. We've been talking with Miss Sandra Jones, who is a licensed, I always want to say professional, but it's clinical, licensed clinical social worker.
Yes.
And we've been talking about mental health issues, and particularly those mental health issues in neglected communities. Now, Sandra, what about mental health and COVID? Has it gotten worse? Is it the same? Or have the issues changed? What is going on?
There's been some tremendous shifting going on since COVID. I have been deluged with referrals of old patients returning and new patients trying to get in. Um, Many people, as you know, are bereaved. There have been so many losses of brothers and mothers and fathers and uncles. I mean, close
Yeah.
relatives unexpectedly.
Yes, I've heard of whole families
Yes.
being lost.
So we're
Mhm.
dealing with massive grief
Yes.
issues and depression.
Mm.
But at the same time, we're also dealing with work issues. There's been some shifting going on in our world
Mm.
because of COVID, where people are working from home more.
Yes.
And then last year we had people working from home, and the kids are at home too, which poses a great deal of stress
Yes.
on mothers or fathers, whoever is at home with the children,
Mm.
trying to work from home simultaneously.
Yes.
And so I'm seeing a lot of people stressed out.
Mm-hmm.
Um, of course, with many parents, especially particularly women, they only take off of work when they're pregnant for 6 weeks or
Mm-hmm.
8 weeks or
Yes.
so.
Yes.
And so I find myself looking at this individual saying, you need time out
Mm-hmm.
to
Yes.
regroup, get restored, get back in touch with you, take care of what needs to happen with your children, then come back and get back into the workforce. So I find myself taking people off of work. Uh, but an interesting phenomena that I see also working that is the fact that for whatever reason, many psychiatrists are not accepting new patients at this in this season.
My goodness. And
S-
what does a psychiatrist do?
The
As,
psychiatrist typically does not provide counseling,
mhm.
but if I wanted to refer a patient for psychoactive medication for depression or anxiety, it would be I would be hard pressed to find one
My
that would
goodness.
take a new patient.
Mm.
Subsequently, as a result, though, what we're seeing is more pop up offices of nurse practitioners
Yes, I've been noticing
instead.
that myself.
They are
Mm-hmm.
they are officed without uh, doctor backup.
Yes.
They're writing prescriptions, and the problem that that poses is that when a person is off on medical leave, many of these disability insurances will not approve the leave unless that patient is actually seen by a psychiatrist.
Mm-hmm. Why do you think the psychiatrists
It's
are not? What's going on with them that they're not seeing patients? Are they
not
overloaded, or
well.
are they just afraid of the new types of mental illnesses?
I think they feel like they have enough. I
Oh.
had one psychiatrist. He was in this. He is in DeSoto, but he and I typically we refer back and forth to each other. But he called me and said, "Sandra," he says, "I'm not taking any more new patients."
Mm.
And I said, "Well, why?"
Mm-hmm.
He said, "Well, I'm just not going to take any more for a while." And that was in the midst of COVID, right in the middle of it. I don't know whether they were afraid of getting COVID. Some psychiatrists that are still practicing are doing virtuals.
Yes. Okay.
Okay.
I
So,
suppose I hadn't thought about that, but there probably is a fear, maybe among doctors and other healthcare workers, of getting COVID themselves, and that could be
yes,
one of the reasons that.
yes.
Yes,
Yeah.
possibility. Thinking about
But the
that.
nurse practitioners aren't afraid.
Yeah,
Not
because
at
the
all.
money, the
No, they're
money
not
is there.
afraid.
Yes, because they're
Yeah.
getting the money. Well, I wonder too. Thinking again about families, I'm really concerned about how families can recognize
Mhm.
some of these issues, some of the things that they can do. Many families, from
Mhm.
my own experience, not
Mhm.
being a clinical person,
Mhm. Mhm.
will begin to label a person with a mental issue.
Mhm.
They'll call them lazy. They say they don't want to work. They're disrespectful. They're arrogant, and they may be all those things. But do you think that may be related to their issue?
Absolutely. Uh, One thing that a parent or close family member, if they're living in the home with the identified person that seems to have a problem, is to say, why don't we go to counseling? Don't just send that person to counseling. Why don't we go? And because I'm having problems understanding what's going on.
So to
Okay?
get more involved
Right.
into their issue
Right.
once they recognize it as an issue.
Nobody wants to be identified with a problem.
Yes.
You're the problem. You need to go get some help. Okay, that puts resistance there
Mm-hmm.
because that person may not want to have a problem and is not going to agree with you on that
Yes.
sometimes,
Yes.
you know. And
Mm-hmm.
so if you join that person in going to get help, let's go get help.
Mm-hmm. Mm-hmm.
He'll be
Mm-hmm.
more inclined to go with you
Yes. And that.
because he's going also to help you.
Yes. Yes. Well,
Okay.
Sandra, I did want to ask you about. You mentioned drugs.
Yeah.
Um, is that the best way to treat people with mental health issues? Should the family seek medication for them? Many
Not
of the drugs
the
keep them drugged out.
Well, the
So,
family shouldn't seek it. Um, However, as I stated earlier, if I'm seeing a patient and their depression is so deep, talk therapy sometimes is is you're limited as to how you can bring that person out of that dark place. I'm not talking about being on medication for the rest of your life. And I'm not talking about heavy duty drugs.
mhm,
I'm just talking about lifting your mood, getting you back to the point where you're motivated to get up and go walk.
mhm, mhm.
Okay,
And so
that
you
involves
think,
motivation.
okay, so drugs help in
It
that regard.
does. It can,
Uh-huh.
if treated appropriately.
Mhm.
There are some, I have to say, doctors who really don't know what they're doing.
Yes. Yes.
If you think about going to your PCP, generally they have 6 weeks rotation
Mhm.
in mental health
Yes.
because they don't specialize in it.
In that. Yes.
So, what they
Mhm.
know about medications and what the pharmaceutical reps may share with them about that
That
particular
particular,
medication.
yes. So if someone wanted to get in touch with you, how could they get in touch with you?
I'm located in Dallas, Texas, at 8500 North Stemmons Freeway,
Mhm.
Suite 5054. My office number is 972 293 7100.
Thank you for being here with us today, Sandra, and thank you for joining us. And we will see you next time on Retrain Your Thinking with Pastor Johnny. And remember, don't just think about it, be about it. That was great. That
Amen.
was great.